Are you diabetic, or do you know someone who lives every day with the challenge of diabetes? Then you already know how important it is to keep blood sugar under control and to take complete care of your health. And there is something that often goes unnoticed but makes all the difference: vitamins. That's right. Some specific nutrients can help a lot in controlling blood sugar, in addition to strengthening the body against the complications that diabetes can bring. In today's video, you are going to discover the 3 essential vitamins that every diabetic should include in their routine. These are nutrients with scientific backing, capable of improving metabolism, strengthening the immune system, and even helping with insulin sensitivity. So if you want to know how these vitamins can help you live better and control your blood sugar, stay with me until the end, because today's tips are valuable and can make all the difference in your health. Vitamin D. Vitamin D, often called the sunshine vitamin, is a true treasure for those living with diabetes. Although it is mainly known for its role in bone health, science has shown that it also plays a crucial role in controlling blood sugar and preventing metabolic complications. To begin with, let's understand that vitamin D is a fat-soluble hormone that the body can produce when the skin is exposed to the sun. However, people who spend a lot of time indoors or live in regions with little sunlight end up developing a deficiency of this nutrient. Scientific studies indicate that adequate levels of vitamin D are associated with better insulin sensitivity, as it is the hormone responsible for transporting glucose into the cells. When insulin works better, the body needs less effort to control blood sugar. Moreover, vitamin D helps to reduce chronic inflammation, which is one of the underlying causes of type 2 diabetes and its complications. Another relevant point is that vitamin D actively participates in the modulation of the immune system. For diabetics, this is especially important, since the immune system can become more vulnerable and the risk of infections increases. With strengthened immunity, the body deals better with external aggressions and recovers more easily. The best source is, without a doubt, sun exposure. From 15 to 30 minutes of sun per day, especially in the early morning hours or late afternoon, already helps a lot, especially in areas like arms, legs, and face. Some foods like eggs, fatty fish, liver, and mushrooms contain good amounts of vitamin D. However, in most cases, intake is not sufficient to reach ideal levels. That is why many health professionals recommend the use of vitamin D supplements, especially during the winter months or for those who show a deficiency confirmed by tests. A practical tip for everyday life is to combine vitamin D with foods that contain healthy fats, such as avocado, olive oil, or nuts. It is also worth highlighting that maintaining good levels of vitamin D can help prevent kidney complications, a common problem among people with diabetes. There is evidence that this vitamin contributes to kidney and cardiovascular health, reducing blood pressure and protecting blood vessels. In short, vitamin D is a powerful ally in the routine of those who have diabetes. 2. Vitamin E. Vitamin E is a true protective shield for those who have diabetes. Rich in antioxidant properties, it fights free radicals and protects the body's cells against damage, something especially important for those living with high blood glucose levels. Diabetes, especially when not well controlled, can cause constant oxidative stress in the body. This stress happens when there is an imbalance between the production of free radicals and the body's ability to fight them. This leads to premature aging of cells and an increased risk of complications such as neuropathies, diabetic retinopathy, and cardiovascular problems. This nutrient acts as a potent natural antioxidant, neutralizing free radicals and helping to protect tissues, blood vessels, and nerves. For diabetics, this means fewer cellular damages, less inflammation, and more protection against the chronic complications of the disease. In addition, studies show that vitamin E can help improve insulin sensitivity. This helps the body use glucose more efficiently, reducing blood sugar spikes and making glycemic control more stable throughout the day. Another important benefit is that vitamin E can protect the heart, one of the organs most affected in people with diabetes. It helps prevent the buildup of plaques in the arteries, contributes to blood pressure control, and improves circulation. In other words, besides directly helping in glucose regulation, it also works in the prevention of cardiovascular diseases, which are one of the leading causes of mortality among diabetics. Vitamin E is present in plant-based foods, especially in sources rich in good fats. Highlights include cold-pressed vegetable oils, Brazil nuts, almonds, sunflower seeds, avocado, and spinach. Consuming these foods frequently and in a balanced way is a practical and healthy method to maintain good levels of the vitamin. It is worth remembering that, since vitamin E is also fat-soluble, it needs fat to be well absorbed. Therefore, when consuming vegetables with this nutrient, it is advisable to add a drizzle of olive oil or another healthy fat to the preparation. In some cases, a doctor or nutritionist may recommend vitamin E supplementation, especially for people with a diagnosed deficiency or a history of complications related to oxidative stress. A practical tip for everyday life is to make a mix of seeds and nuts and keep them in small containers for quick snacks. This way, you ensure a natural source of vitamin E and other essential nutrients, such as magnesium, fiber, and healthy fats. Another interesting point is that vitamin E is also being studied for its neuroprotective effects, which may help preserve brain health in people with diabetes, who have an increased risk of dementia and Alzheimer's. 3. Vitamin B12. Vitamin B12 is often overlooked in health discussions, but for those with diabetes, it deserves a prominent place. This nutrient plays essential roles in the body, especially when we talk about the nervous system, energy production, and metabolism. An important point to consider is that many diabetics, especially those who use metformin for a prolonged period, being one of the most common medications in the treatment of type 2 diabetes, they may develop a vitamin B12 deficiency without realizing it. This is because metformin interferes with the absorption of this nutrient in the intestine, which can lead to symptoms such as tingling in the hands and feet, excessive tiredness, muscle weakness, and even mental confusion. Vitamin B12 deficiency is also linked to a higher risk of developing diabetic neuropathy, one of the most common and bothersome complications of the disease. B12 helps keep nerves healthy, favoring the conduction of nerve impulses and preventing damage that causes pain, burning sensations, or loss of sensitivity in the extremities of the body. It also plays a role in the formation of red blood cells and DNA synthesis, meaning it is essential for cell renewal and tissue oxygenation. When it is lacking, the body can enter a state of anemia, leaving the person without energy, with difficulty concentrating, and more vulnerable to infections. Another interesting aspect is that it is involved in the metabolism of homocysteine, a substance that, at high levels, is associated with cardiovascular diseases. Having good levels of B12 helps keep homocysteine under control, reducing the risk of heart attack, which is more common in people with diabetes. The vitamin is naturally present only in animal-based foods. Good sources include meats, eggs, milk, and dairy products, fish, and seafood. Therefore, people who follow a vegan or strict vegetarian diet are even more susceptible to deficiency and should undergo more rigorous nutritional monitoring. Neglecting this nutrient can bring serious consequences, but the good thing is that with attention and proper monitoring, it is possible to maintain healthy levels and prevent future problems. If you are diabetic, including these nutrients in your routine with professional guidance can be a simple but powerful step. Now tell me, do you already use any of these vitamins? Do you have any doubts about how to consume them? Or do you have a tip that worked for you and could help more people? Write it here in the comments. Let's exchange experiences and learn together. And of course, If this content helped you, leave a like, share it with someone who also has diabetes, and subscribe to the channel so you don't miss the next videos. Here, there are always good tips for those who want to live better, with more health and autonomy. I'll see you in the next video. Until then, take good care of yourself.